My dad is a large influence. He was a cardiologist ever since I was a small kid. I guess I was just watching him and learning. We do coronary bypass, valve surgery, aneurysm surgery, surgery for atrial fibrillation. First visit that we are involved with a patient could be in the clinic or in the hospital. Usually when we see a patient in the hospital, it's something relatively urgent, meaning that a decision has to be made that whether the patient should have surgery or what type of surgery, trying to figure out what the patient understands of the problem, what the symptoms are, and us trying to get as much information from that first visit as possible, answer all the questions and establish what the plan would be. And sometimes we go for surgery, sometimes we prefer to observe patient, and sometimes it's just a follow-up. So the most common operation that we do is coronary bypass surgery. The coronary bypass operation involves usually anywhere from 2 to 5 bypasses. We try to do multiple arterial grafting on those patients. So if it's a good match, the arterial graft, we think has a better durability in the long term. So it gives the patient freedom from problems. Nowadays, a lot of the valve procedures are done endoscopically or transcatheter sort of approaches. We have a wide variety of operations that we offer: aortic valve replacement, mitral valve replacement or repair. The next most common operation is the aneurysms. So these are enlargements of the ascending aorta, usually in the chest. And then there's other procedures like atrial fibrillation surgery, which is an ablation. It's called MACE procedure. That the goal of that is to get rid of the abnormal electrical circuits that occur in the heart, so that the patient can go back to a normal sinus rhythm. The patient will get a visit from us, from me and our team every day. We would try to make their stay as easy as possible, and as short as possible. I would say it's the most rewarding thing is having done the operation with the feeling that the patient will benefit from it and live longer. If we can keep the patient out of the hospital, that's our goal. I was born in South America, so I speak easily. I can speak Spanish with patients, which has helped me in the past. And I speak Italian. My family originally is Italian. When I'm not working, I usually like to spend time with my family, and we like to spend time outside as much as possible.